Hi everyone, my name is Dr. Uri Burstyn, and I'm joined today by young Dolly here to talk to you about the management of canine arthritis, which is a very important topic because, of course, one of my favorite sayings is that every joint gets arthritis if you're lucky to live long enough. And Dolly is, of course, a perfect illustration and perfect co-star for a video on arthritis because she's a poster child for the kind of animals that really have to deal with it later in life. Large breed dogs. Almost all of them will have some degree of arthritis once they get up to their middle age and older, although arthritis really affects every species and every dog breed out there. Now, I'm going to tell you guys a little bit what I mean by arthritis, because there are different definitions of it, and then we'll dive into specific strategies on how to manage osteoarthritis in your dog. What I mean specifically when I talk about arthritis in this context is osteoarthritis or degenerative joint disease, which is the age-related variety. As many of you probably know, our bones have a coating of cartilage on the ends where they meet, the space called the joint. And that cartilage acts like a little lubricating coating on the ends of the bones that lets them glide past each other. Think of it like the Teflon coating on a frying pan. It's there to make everything smooth. And what happens with age and wear is that that coating can get chipped, it can get eroded, it can get flaky and kind of dry, and in the end it can get worn away. And that process is degenerative joint disease, osteoarthritis, or just arthritis. And what happens when you have an erosion of this cartilaginous covering on the ends of the bones is bones start to grind on each other, which is very painful. And of course, just the process of erosion causes inflammation inside the joint, which is also painful and also reduces the mobility within the joint and reduces the sensitivity within the joint, all of which contributes to what we see with arthritis, which is joint pain, lameness, limping, stiffness, and just generalized discomfort. So that's what arthritis is in the context of the kind of age-related degenerative joint changes that we're currently discussing. Now that we have a good idea of what we're talking about when I say the word arthritis, let's talk about how to manage it. And remember, everything we do as veterinarians has the goal of making the quality of life better for our patients. So arthritis management, like everything else in vet med, is focused on patient comfort, first and foremost, and secondary on limiting the progression of the pathology and avoiding side effects. And this is really good because unfortunately there's no cure for arthritis. There's no way to fix the degeneration of cartilage once it occurs, and there's no way to replace or regenerate cartilage. There have been a lot of interventional techniques tested over the years for osteoarthritis, and unfortunately they've all been discarded as not helpful. If you want to do some research, you will find people talking about things like needling cartilage, cartilage grafts, stem cell transplants, platelet-rich plasma infusion. None of this actually works reliably. And although there is some excitement about stuff like PRP and stem cell therapy, again, it's very much experimental at this stage, and none of it really works, although there are many facilities offering it and charging a lot of money for it. It really is a bit of a gamble, and I'll talk to you guys about the placebo effect in a minute. The other category of interventions that probably don't work, but everybody tries, that I feel like I need to mention before we go any further, is supplements. And here I'm going to disappoint a lot of you. There is a lot of talk about supplements for arthritis. It's a billion-dollar market worldwide, and unfortunately, they just don't work. Now I know everybody's giving their dog glucosamine and probably taking themselves. Everybody's got like the New Zealand green lip muscle products and all the other acronyms for, theoretical cartilage components. But I'm really sorry to say, none of those have really been shown reliably to be of any benefit to patients with osteoarthritis. Glucosamine was a big, exciting thing when it burst to the market based on the one study done by a company that then made like $1 billion selling it, that showed that there was benefit from taking it. It was going to reduce inflammation in joints and make patients with arthritis more comfortable. And then subsequent studies progressively failed to show any positive effect. And a meta-analysis performed around, I think, 2015 showed that really glucosamine doesn't really do anything. And that only that first study, again, done by the company that was going to sell a lot of it, showed any positive response. And the same goes for pretty much all the other joint supplements out there. You can ask yourself, why does every veterinarian in the world sell glucosamine supplements? Why does every pharmacy sell glucosamine supplements to humans? And the answers are pretty obvious. A, money. B, hope. arthritis is something you just have to live with your whole life. And sometimes it's worthwhile giving a supplement to people because it makes them feel better, because the placebo effect is real. And the placebo effect is real in veterinary medicine as well. It just doesn't benefit the patient. So we have very reliable evidence showing that the placebo effect in animals is the same as in humans, 30%. If I give you a sugar pill and tell you this will make your dog limp less, 30% of you will agree with me. They'll say, yeah, doc, that really helped my dog, which is kind of the same ratio as we see in humans. But unfortunately, it'll make you feel better. It'll make you buy more of those pills. It will not help your dog at all because they don't know they're meant to be benefiting from it. So yeah, I'm sorry to say supplements do not work. And one of the reasons I think the veterinarians do sell them as much is not necessarily that they just want to make money. It's just that managing arthritis is hard. And if you're not very good at it, then you use the tools that you've got. I personally do not use these supplements at all in my practice. And I have a very, very high success rate managing osteoarthritis in my patient population. So I'm very confident in saying that the supplements do not play a significant role in getting these dogs comfortable and functional and letting them live a comfortable, long life. But the reason I can say that is because I do a bunch of other stuff that really, really works. So now we're going to get into that. So interventional procedures, no evidence they're beneficial. Supplements, no evidence they're beneficial. Don't waste time and money and don't stress out your dog by doing that stuff. Please do the stuff that works, which is, drum roll, please. Okay, this first one is going to be really, really boring. And this is like the most generic doctor advice. Exercise and diet. Weight is by far the biggest contributing factor to discomfort with arthritis. And staying on the skinny side of normal is going to make any patient with arthritis more comfortable and more functional. This is particularly important in giant breed dogs like Dolly, like your St. Bernards, your Great Danes, like any of these big dog breeds. They're carrying a lot of weight on their joints. And just simply being on the skinny side of healthy is going to make them feel way better throughout their entire life. The advice I give the owners of any large breed dog, starting from when they're a puppy, is keep them on the skinny side of normal. Now, veterinarians determine how fat or skinny a dog is using a body condition score, either 1 to 5 or 1 to 9, with middle of the road, 3 on a 1 to 5 scale or 5 on a 1 to 9 scale being perfect, and then 9 being like spherical, 1 being skeletal. So large breed dogs, I want to keep them like a 4.5, maybe a 4 out of 9, rather than a pure 5. The skinnier they are, the less weight their joints carry, and the more comfortable and the more healthy they're going to be well into old age. My first piece of advice whenever I diagnose arthritis in an older animal is weight loss. And I'm going to give you guys a little anecdote to illustrate just how overlooked this super important factor is. So about 15 years ago, I was invited as a group of veterinarians to tour the Purina research facility, which is where they develop all of the Purina clinical diets and all the dog foods. And it was a really fantastic trip. I mean, that facility is like heaven for dogs and vets. It's really cool. Really cool research gets done there. But the interesting thing I want to relate to you guys is that they had this group of I think it was 30 of like practicing clinicians, practicing veterinarians, body score a bunch of dogs that lived at this facility. And all of us scored normal dogs as being too skinny and slightly chubby dogs as being normal, which just shows you that pretty much every dog that a veterinarian sees in practices probably could stand to lose some weight, and that we basically calibrate ourselves to the normal, which is heavier than optimal. So I've taken that into my own practice, and I really, really kind of try to check myself and try to encourage owners to keep their large breed dogs on the kind of like body condition score 4 to 4.5 out of 9. And it makes a huge difference. And quite often I see dogs that are like limping and like need painkillers every day, and they drop weight and all of a sudden they don't need pain control anymore. Or they need like, a pain control 2 or 3 days a month instead of every day. So it really does make a huge difference. And weight loss should be tackled seriously in the context of any large breed dog or a dog with arthritis. And again, I'm going to say something that super boring, but diet. Just, you got to pick the right food for them. A lot of commercial diets just have too many calories for a domestic dog. So again, use clinical prescription diets for weight loss to make your dog lose weight, and then use a good maintenance diet to make that weight loss stick. And already you will benefit any large breed dog, but particularly one with arthritis, tremendously. So keeping skinny, super important, makes a huge difference to these dogs. And again, probably the most effective intervention for most dogs with arthritis is just make them lose weight. Now, diet and weight loss are only half of the boring doctor advice equation. The other half is exercise. Muscle tone is really, really important to keeping joints stable, which keeps joints comfortable. And what happens when you're limping is you're basically not using that limb, which means you're going to start losing muscle mass in there. And that means that joint's going to become less stable and more prone to pain. So it kind of becomes a positive feedback loop that takes you in the wrong direction. The other thing that happens when you're limping is, of course, you're putting more weight on your other limbs. So those joints are carrying a higher load, which means they're going to be degenerating faster and feeling less comfort as well. So when you have that one non-functional limb, it makes all the other limbs less functional as well. It's funny because in human side of medicine, there are studies showing that you can predict longevities, how long elderly people live, based on how fast they walk. So if you measure a bunch of people over 65, you can pretty much predict their quality of life and their duration of life based on walking speeds. And that is because they're so closely linked to orthopedic health, orthopedic wellness, and fitness. So in dogs, we want to promote good muscle tone, particularly in older dogs, large breed dogs, as they develop arthritis. And one of the main ways to do it, I will talk about in a moment, is pain control, so pharmacologic interventions. But there's others, regular walks. Swimming is fantastic for animals with arthritis because it's low impact exercise on joints. Again, same as in humans. You can take dogs swimming in your lake, local beach, out in the wilderness, or, most cities do have doggy aquatic kind of fitness centers, doggy pools. A lot of doggy daycares have little water features. There's veterinary physiotherapy facilities that have water treadmills. It's like a little treadmill that fills up with water up to your dog's chest and kind of forces them to walk through resistance. So there's a lot of options like that to maintain a dog's fitness as they age and as they develop orthopedic problems that range from, free, going to your local beach, to, going to these aqua paws kind of water exercise facilities for dogs, which you can investigate in your area. Another thing that really helps maintain muscle tone in an arthritic or any limb or any limb affected by lameness is walking on an unstable surface. We're getting a bit into physiotherapy here, but I live in Vancouver. We have beaches here, and walking a dog on sand is fantastic because it forces them to use all four limbs for stability, like on any unstable surface. And that is really, really good for maintaining muscle tone in an arthritic limb. So I always recommend that my clients who have an arthritic dog, take them for walks on the beach. Even if the dog doesn't like to swim, just walking on sand will actually be really, really helpful in maintaining sort of dynamic range of motion in all four limbs and maintaining that muscle mass, which then helps stabilize the joints, which makes them more comfortable. So that's it for the boring doctor advice, diet and exercise, right? So blasé. Now we're going to talk about pharmacology. And everybody wants to know, what pill can I give my dog to make it better? And the good news is there are pills you can give your dog to make them feel better. With arthritis, we know those joints aren't getting any better. We know that there's no way to reverse the loss of cartilage and probably it's just going to progress throughout the patient's life. So the mainstays of arthritis management are painkillers. Now, we have several classes of drug that are very effective for this. And again, I just want to talk about big picture first. A basic principle of pain control called neuroleptoanalgesia is that you want to use multiple drugs at lower doses. And that is always better than trying to use a single drug at a higher dose. And it might be a little bit counterintuitive to some of you because you might be thinking, I want to give only one medication to my pet instead of two or three. I don't want to over-medicate my pet. And I think it's really important to address that concern. And you have to understand the following. There's multiple pathways of pain in the body. Different drug classes tackle different pathways of pain. And giving you just one drug that only blocks one of the pain pathways is never going to be as good as blocking multiple pain pathways. The other side of the equation is side effects. all medications, pretty much, side effects are related to dose. So if you're able to use a lower dose of a drug, you're much less likely to suffer undesirable effects than using a higher dose of a drug. So with those two facts in mind, now you can see why using, say, two drugs that block two different pain pathways at lower doses is better for the patient, because you'll get more effective pain control with less chance of side effects. So the mainstay, of course, of arthritis management is non-steroidal anti-inflammatories. Basically, they're the same as Tylenol or ibuprofen in humans, except, of course, human non-steroidals are highly toxic to dogs. Never, ever give a human non-steroidal to a dog. You will either kill them or end up in emergency spending $5,000 to get their stomach lining to regrow. Never, ever do it. There are multiple non-steroidal anti-inflammatory drugs that are licensed for use in dogs. You should only use those. I want to be super clear about that. The most commonly used one is called Medicam. Pretty much probably every dog owner has encountered it at some point, and it's great. There's multiple non-steroidals out there. You should definitely discuss them with your vet. But pretty much every arthritic patient will benefit from a non-steroidal drug unless there's some really good reason why they shouldn't be taking it, which can exist. I also want to make you guys aware of the fact that Medicam isn't the only non-steroidal out there. There are certain non-steroidal drugs called COX-2 specific non-steroidal drugs. The ones I'm most familiar with are Deramax and Previcox. So I almost exclusively use Previcox in my canine arthritis patients because these COX-2 specific non-steroidals have a better safety profile than Medicam, which still has a very good safety profile. It's definitely a useful tool in our toolbox, but I think Previcox is a better tool in our toolbox because you just get less risk of side effects. And again, it works. It reduces inflammation in joints, provides some pain control. All these drugs are once-a-day dosing, which is nice and convenient. And the way I use them is, it depends on the patient. In some dogs, they might need it every day to be comfortable. Other dogs, who have milder or basically like earlier on in their arthritis journey, you might only need to use these drugs, on days when you expect to go do a big walk, on days that the dog looks uncomfortable. So it doesn't necessarily mean you have to be using these every day. It really depends on the patient. Other drug classes that affect other pain pathways and work really nicely synergistically with non-steroidal anti-inflammatories. The most common one, again, is gabapentin. Gabapentin works in a completely different way. Super effective pain control, really, really safe. Amantadine is another one. And to be honest with you, in my hands, pretty much all large breed dogs that have arthritis, which is pretty much all of them, finish up, spend the last little bit of their life on gabapentin and Previcox, because that combination works really, really nicely. It answers very well and gets these dogs comfortable and functional, often much more so than they've been in the years leading up to starting this kind of therapy. So pretty much pain control is a mainstay of managing these patients once you got their body weight at a healthy range, or the bottom at a healthy, and in combination with appropriate exercise. You don't want to exercise an arthritic patient so hard that they go really lame and sore the next day. You want to exercise them to a point where they're comfortable, but as much as you can to a point that they're comfortable, if that makes sense. The other interventions, there's an injectable medication called Cartrophin. It's kind of from the same class as glucosamine supplements, except it's given as a monthly injection. And I know I said that all these supplements don't work. Cartrophin also probably doesn't work, but there are some studies that show that in dogs, using Cartrophin reduces the amount of non-steroidals you need to keep them comfortable. I used to use it a lot more before some newer drugs came on the market. I still think that it probably makes some difference, but we don't really have strong evidence for it. So it's one of those things that, like, if your vet suggests it, I would seriously consider it. But again, I don't think it's something to make or break the case. And I also think it shouldn't be used as the only intervention. It should be used on top of your pain control. Absolutely first things you do with these dogs is get them to a healthy weight, get them exercising, get pain control on board. And then Cartrophin could be like the next thing you add on if your patient still isn't quite where you want them to be. Now, that brings us up to maybe the year 2020 in terms of arthritis management. We have some new developments in this field. They're kind of cool and exciting. There's new classes of drugs out there that aren't traditional medications that affect body's physiology. They're actually a monoclonal antibody-based therapy. The one for dogs is called Librela. And you might have heard about it if you have a large breed dog. And it's kind of an exciting new development. These drugs only came on the market a few years ago, so we're kind of still learning about them, but they do seem to have a very good safety profile. And they're monoclonal antibodies that actually bind pain receptors in your joints and make you not feel pain. That's pretty amazing. And the cool thing is that they're a once-a-month injection that your vet gives your dog. So really low effort for the owner, low effort for the dog. And for some dogs, it makes a tremendous difference. A lot of patients that used to be on 1 or 2 painkillers can just get a Librela shot once a month and be totally fine and functional. So again, this is a really exciting new development in canine arthritis management. Again, doesn't replace weight loss exercise, but it can replace medication, or if it doesn't completely make your dog independent of painkillers, it might really reduce the amount of painkillers you need to use. So instead of having to give your dog Previcox every day to keep them from limping after the walk, you might only need to give it, again, a couple times a month, maybe on days when you do a big hike. So really exciting development. I mean, there's definitely talk right now, particularly in North America, where the drug is newer than it was in Europe, about side effects. And I just want to say that this drug is licensed. There's a lot of experience with it. It's effective. It is as safe as any other interventions we have. But really important for everybody to know that there's no drug under the sun that is beneficial and doesn't have potential for side effects. Any tool that does something useful can also potentially cause a bit of harm. So that just the fact that there are side effects from a drug should not stop us from using them, because that's when we wouldn't use any drugs at all. The thing we ask ourselves as clinicians is, will this drug benefit a vast majority of patients? Are the side effects acceptable? Do they occur at a low enough rate? And the answer is unequivocally yes for all of the interventions I discussed. So again, don't let the concern about side effects stop you from helping your dog, because 1 in 1,000 dogs might experience some side effect from one of these interventions. 100% of the dogs will experience a benefit. So you just got to do that math and say, all right, risk of side effects is always there, but it's acceptable, and we're not going to worry about it too much. Another little tip I can give you about managing arthritis in dogs is just to try to do your best to make them comfortable by getting them nice, soft, thick dog beds and lots of thick blankets to lay on. Creating really, really soft nests that are easy on those old arthritic joints is actually really important. Some large breed dogs will actually get calluses or even ulcers, particularly on their elbows, when they're arthritic and can't quite position themselves properly. So that's just another little tip that I think will make these dogs a lot more comfortable. So that's a pretty tidy overview of ways we can manage osteoarthritis in dogs. Again, if you have a large breed dog, they might end up on everything I discussed all at the same time, every day, later in life. And that's okay, as long as it's helping them. And remember, at the end of the day, it all comes back to making our little friends comfortable, particularly in the golden years. And again, don't worry too much about side effects. Worry about how comfortable and how happy your little dog friend is. So I hope you found that video useful. Please like and subscribe, share with all your friends. Follow me on Patreon if you want to get more support, or if you want second opinion case reviews, which I do offer on there. And please check out the description below for links to some of the other videos that I have on how to diagnose and manage and prevent, or at least delay, the development of arthritis in dogs. And thank you very much for watching.